Hey, Jordan. So I am recording this, so if anybody is unhappy about that, you can shut your camera off. But this way we can share it with other folks. I'm going to wait just maybe about another 30 seconds or so. Then we'll get started. All right. For the sake of time, I am going to go ahead and get started. Hello, everybody. Thank you for joining me this evening. I know that coming home and working some more is not always at the top of everyone's list of things to do on a Tuesday, but thank you so much. This is our quarterly meeting for the Central Illinois Breastfeeding Professional Network. If anybody is joining us for the first time, welcome. Just a little refresher on what the professional network is. Our network kind of lives under the umbrella of the Central Illinois Breastfeeding Task Force, kind of a committee that we put together to bring together professional folks from the Central Illinois community who support breast milk feeding in our community. This was put together as a part of our iSpan project that we currently have going on in Peoria. We've been working with the Illinois Public Health Institute and the Illinois chapter of the American Academy of Pediatrics on our iSpan grant. iSpan stands for Illinois State Physical Activity and Nutrition, and our goal is to increase breastfeeding continuity rates, specifically amongst African American low income and rural families. And one of our tasks for the iSpan grant was to bring a collaborative approach to supporting breastfeeding to our community. And the professional network was born to achieve that goal. So what have we been up to in the last quarter? We've had some fun things going on. We had 2 Lunch and Learn webinars. Those were number 3 and number 4 for the year, and they were all very successful. And my plan is to continue to do them next quarter. They had just kind of been a whim that I had and thought that it might just be for 1 year, but I think we're going to get funding to do those for another year. So I'm very excited about that. But we had breastfeeding and social media July 30th. Trish Wairinga did a fantastic job with that. And then on August 27th, we had Joanne Allen. The topic that she spoke about during Black Breastfeeding Week was Pause and Discover the Power of Breastfeeding in Black Communities. Very insightful presentation by Joanne. Those and all of the webinars that we've done as Lunch and Learns are available as recordings. So if anybody would like the links for those, let me know and I can send them to you. Last week, we did something that I found to be very exciting. We went to a health fair representing the professional network. So the pictures in the middle, down at the bottom, we have Etta from, she's a labor nurse at OSF in Peoria at St. Francis, and Katie Madigan, she also works at St. Francis at the Breastfeeding Resource Center, and myself, we were invited to this health fair that was sponsored by Early Head Start and Head Start, and we represented the professional network. So what was really amazing, I had sent out an email asking if anybody would like us to hand out flyers from their organizations. And so it was just a really good feeling to kind of be a one-stop shop for lactation support and give out information from OSF, from Unity Point, from the Empower Life Pregnancy Center, from Family Connects, from WIC, from Kara Sylvester, our private practice lactation consultant who is probably on this call. We had a matching game for the kids, and then we had another little kind of craft thing for the kids. So it was a lot of fun, and we look forward to representing the professional network at future activities. So that was that. Then we also, in the end of, what was that? The end of August, we had our inaugural Black Breastfeeding Week event. And this was very much a culmination of all of the work that we've been doing to reach out to the Black families in our community. We've never done a Black Breastfeeding Week event in our community before. I was unable to attend, and I have heard nothing but just excitement about this event. We had a subcommittee of community members. Their names are listed here. Their pictures are all there. And they put together a fantastic event. And I know that there are plans to have another event next year. But what was really exciting about it was we had representatives from different organizations in the community. St. Francis staff was involved, Unity Point staff, health department staff, volunteers from the Central Illinois Breastfeeding Task Force. It was truly a community collaborative and really, really exciting. So I think I've got some more pictures from that. They had a bouncy house for the kids, a Kona ice truck. I love this picture. Rhonda Woodkey, one of my coworkers, took it of a parent standing there breastfeeding her little one. You can see those little telltale legs sticking out, and she has her drape across her body, but getting something from the Kona ice truck. There were wraps provided by a Black-owned business in Peoria, Rhapsody. I heard that the food was really, really good. There was broadcasting from a local radio station, and I heard that was successful in getting more families to the event. So a really, really exciting thing. And we had volunteers from McLean County and Peoria County. There might have been some from Tazewell too, I'm not sure, but truly a collaborative event, which is what we've really been working on with the task force and the professional network. So that was exciting. So another exciting thing that we've got going on, the Illinois Public Health Institute is writing an article about our work that we've done in Peoria, primarily about the Central Illinois Breastfeeding Professional Network. So we're all going to be famous, hopefully. We're writing this article, and they will submit it to a specific journal who I cannot think of the name right now. If Dr. Shallett is on, she might be able to chime in with the name of the article. But I had sent out a survey to all the members of the professional network because we would like to list the organizations that are included in the professional network in the article, but we would like your permission to do that. So I sent out a survey. A lot of you have filled it out. Thank you. If you have not, if you could check your email for an email from me and fill out that survey. It doesn't take very long to fill it out. There's 4 questions. One of the questions, and we've had 15 responses so far when I put this slide together, that we asked because we're looking at, have you developed relationships with other community organizations through the professional network? And very exciting that the majority of participants have said that they have. And for the article, we are also going to talk about some of these new connections that have been made. And so we asked, who have you been working with that you haven't had a relationship with before through the professional network? And I was really thrilled at how many organizations were listed. And it also told me that we need to reach out a little bit more to our friends in McLean County and engage them a little bit more in the work that we're doing, because obviously some of us are reaching out to them, and that is fantastic. So just kind of for you to see the organizations that we're working with. So one thing I just wanted to talk about real quickly here is we were working today on our goals for iSpan for 2022. And one of them is to continue collaboration with community breastfeeding partners through the task force and the professional network and ICAP. And we want to come up with a new collaborative initiative designed to improve breastfeeding support equity. And one of the things that we have talked about with our local health departments is kind of having it. This has been like a dream, pie in the sky fantasy. It's kind of having like a one-stop shop, like a drop-in kind of thing that meets monthly in perhaps different places in the community to provide breastfeeding support, maybe some other support that folks might need. I would just love to kind of pick your brains about if you think this is a good idea, what we could offer if we did a local drop-in. We were thinking that if on the first Tuesday, and I'm just throwing that out, the first Tuesday of the month, we were at the health department. We were there, every month, and people knew that they could come there for help with breastfeeding, to get their baby weighed. What could we do? What could get families to come there? Would this be monthly? What would be the best location for it? Who would staff it? So, we would probably need our community organizations to commit to saying, yes, we'll send, somebody who can support breastfeeding, over to the drop-in once a week or once a month. So I would love it. I mean, if anybody wants to chime in with thoughts about that, I would love to hear your thoughts. You can drop them in the chat box as well.
Hey Beth, it's Teresa Ramos. So what I'm looking at, I'm kind of looking at your outline here. So, with COVID, and unfortunately, this isn't going away anytime soon. Like, are you guys looking at keeping it down by numbers initially? Kind of, some moms might be a little leery about kind of coming out, and going into public. I know the breastfeeding support that OSF has, the clinic, I was blessed to be able to go over there, and those lovely people are able to kind of keep people at a distance while still kind of meeting. And of course, they would meet with moms individually in rooms, like staffed by, like with us through Family Connects, there's several of the girls there that are CLCs. So I don't know if that would be something that you would want, or if it would be required to have an IB CLC as well as a CLC be there. Location wise, I mean, it's too bad you couldn't have like almost like a mobile unit. I know that's kind of a pie in the sky idea as well. Because you could do it downtown at the health departments, but what about the moms that live north of Peoria, in the Dunlap area, or as far west as going toward Galesburg and Peoria? And then, where would you cut that line off? I mean, those would be my questions and comments, concerns.
Yeah, a mobile unit would be fantastic, wouldn't it? So if anybody, knows how to make that work for us. But yeah, I mean, all the COVID exposure, Teresa, that is a really good point. And that's one of the reasons why we haven't been doing drop-in at Methodist. I know that the OSF Breastfeeding Resource Center, that they are doing their Wednesday group. I was with Katie last week on Wednesday, and I mean, she had a really good turnout there. So I know that, people are still looking for this. We've had a lot of people call us about our drop-in, and, as we think about starting that back up, we were, thinking, do we have like an online sign up where, we can have 5 people come in the first hour and then 5 people in the next hour. That kind of loses the whole drop-in part of it. Yeah, could we have it in a place big enough where we could have a few scales and we could have a few rooms and we could split people up like that? I don't know where that kind of location would be. So I mean, there's all kinds of possibilities and all kinds of complications because of COVID.
Beth, this is Kara. I did over the summer, the park pop-ups, which I know is a little different than what you're talking about, just at different parks around the area. And I mean, like any support group, it was kind of slow to get started, but I did end up having a handful of moms, like 3 moms at once, and then a total of 4 at this last one. And there was more that were interested that just couldn't make those days. And I kind of I hadn't done anything for September just because I felt like it needed to be more consistent. I was trying different days and times and weekends and weekdays in different parks because I wanted to see what would work best. And, but I feel like there definitely are moms who are seeking that in-person stuff. So I am available to help however you need. And I would love to help get ideas out there for this. So.
Okay. Thank you so much. If anybody, if we have any organizations at this meeting who feels like they could help to staff this, just send me a message and let me know. Because, we would really need to kind of work on making this a very organized, kind of thing. And I think that it would be probably a work in progress. Ashley in the chat is saying, I would think starting with 1 location would be good, then expanding to 2 to 3 sites as we have capacity. Yeah, I mean, it would be great to do it more than once a month, too, I feel like. So yeah, consistency in time and location would have better turnout. Yeah. And like Teresa brought up, we would want to, would we want to have different sites? One of the things that we want to do is make it accessible for folks who don't have transportation, where they could possibly take the bus too. So that's one thing that we would want to think about as well. I don't know Heartland on, one of the Heartlands, if they would have room for us there. So yeah, so for the sake of time, I'm going to go on, but if anybody has other ideas or your organization would be interested in helping this happen, then please contact me. Shannon, so OSF, Shannon asked in the chat, are there still breastfeeding support groups? OSF is doing one now, but it's on Wednesdays at noon, and that's the only one that I know of, unless anybody is telling me differently. And Katie on Wednesday, she said that they had 13 moms there, which for a support group, that is a really good turnout.
Yeah, I was thinking since the baby place closed, there probably wasn't one in Pekin anymore. So I, with Child and Family Connections, have been wanting to actually get a hold of you, Beth, because I've been wanting to team up with you and do something with breastfeeding and trying to get those like little babies, like basically under 1, we have a hard time getting that population. And I think that doing something like you're talking about would be great. And I could be there doing like screenings also if they want that, because I know like you don't always know what milestones your child should be hitting before 1. Like, you know, they should be crawling, you know, they should be walking, talking, all that, but you don't exactly know like what's normal, when it's too late, that kind of thing. So I've been wanting to actually get in touch with you about that. So I'm on board with whatever you decide.
That is a great idea, Shannon. So let's talk about that. I have
Okay,
your email address, so I'll contact you and we'll figure out a time to talk.
perfect.
But that is a great idea.
Yes, because I know like with Avery, when we figured out she wasn't tracking with her eyes yet, like that was when I was with you and Christy for like a weighed feeding. So like I think getting the moms when they're in there, you know, doing weight checks or something like that, that would be a great time to do that.
Yeah, thank you so much for that. Dr. Shalit is saying that she thinks Heartland Knoxville would be open to using their space, university peds too. So good. All right. Thank you so much, everybody, for your input on that. I appreciate it. I really do think it would be a very, very exciting thing that we could work on making it happen. So, okay. All right. So at this point, I am going to have Dr. Zobrist and Dr. Shalit. I'm not sure which one is going to take over talking, but we are going to hear about the Heartland Quality Improvement Project that was done for breastfeeding. And you just tell me when to advance slides.
Okay, so I can talk. So I'm Casey Zobrist. I just graduated my peds residency and will be starting at Springfield Clinic here in Morton as a pediatrician actually on Monday. So this was my project that I did throughout residency, and it was improving breastfeeding rates at Heartland Clinic, and it was done throughout my residency. So I'm gonna go to the next slide.
Sorry, I'm asleep.
Oh, it's just some background about disparities in breastfeeding in different populations. There are higher breastfeeding rates in the Hispanic population than the African American population, but still is lower than in the white population. Reasons for not initiating breastfeeding that were found: lower education, poverty, younger age of the mother at delivery, a mother with a higher BMI, not abstaining from alcohol during pregnancy, smoking within 6 weeks of delivery, and living in rural areas. And the Healthy 2020 goal was to have a 20% difference in initiating breastfeeding in a population with lower socioeconomic status, which is why this research is so important. So some baseline data that was done in 2019 shows the disparity at OSF for our breastfeeding in the hospital. You can see in the African American population, there was a 25% rate of mothers that were breastfeeding, 26% in the Hispanic and Latino, and a 62% in the Caucasian population. So a big disparity seen in 2019. And then when you look at insurance, if you have commercial insurance, they were 66% of those mothers were breastfeeding, compared to mothers that were on Medicaid, only 33% were exclusively breastfeeding. So some statements that we looked at are problem statements. Lower socioeconomic status and being a person of color is associated with lower breastfeeding rates. Heartland Clinic primarily serves people of color, so this was something that was very important at Heartland Clinic. From our baseline hospital breastfeeding initiation data, there was significant opportunity to support our Heartland families to achieve breastfeeding rates and to have breastfeeding success. An improvement of breastfeeding support and success would require and is going to require collaboration of the entire community and medical entities. So this was just the Heartland Breastfeeding Initiative team, people all across the board helping out with the project. And our aim statement is what we were trying to do. We were trying to, by May of 2021, so this time is coming past because this was presented in May, but infants that were evaluated for their 2-week well child check at Heartland Knoxville Clinic, we were trying to increase any amount of breastfeeding by 20% from baseline, meaning that they could be breastfeeding and also supplementing with formula, and that was still considered part of our 20% increase that we were trying to reach. And by May of 2021, infants evaluated at their 6-month well child check would have an increase of 10% from baseline data in any amount of breastfeeding. So our key driver were things that we were trying to look at and see how we could move this aim statement to get our increases. So some key drivers that we saw and some barriers that we found: cultural norms, socioeconomic barriers, work schedules of moms, having other children just being pulled in a lot of different directions, knowledge gap, maybe not having the information on the benefits of breastfeeding and where to be able to go to get breastfeeding help. Ability to track data was difficult because there's no system in the EMR to be able to pull this data very easily. At Heartland, unfortunately, there's a lot of no-shows. So when parents were not bringing the babies in, it was hard to be able to get that breastfeeding help and education. There's a lack of prenatal care and education, lack of consistent care in the hospital, lack of resources, and lack of a breastfeeding infrastructure. And some key interventions, the ones that are in red were the ones that we were trying to work on during my research. So we were implementing Ready, Set, Baby, which is a program where you're educating parents on a lot of different things, but part of it is on breastfeeding, trying to help with outpatient lactation referrals, increasing CLC staff at Heartland Knoxville. We included documentation in the notes of the residents, which I'll show here in a couple slides, connecting with Family Connects in the hospital to try to help moms before they even left the hospital get connected, and also expanding on education on breastfeeding for all providers. So the PDSA cycle number 1, first we recognized that there were gaps in care concerning low breastfeeding rates, and that we pulled the manual baseline data which supported these low breastfeeding rates. We then added smart phrases, and the smart phrase is just something that the residents are able to pull directly into their notes, so that way they can ask regimented questions to the parents. So that way it was the same question for every visit. Then we collected data monthly, and then we continued barrier identification and interventions. This is the documentation, the smart phrase that I mentioned. So this was in every well child check from birth to 12 months. And this was asked at each of those well childs, and every resident asked these questions, or they were at least supposed to. So we asked, how are you currently feeding your baby? And the options that they could choose were the box that's in white over on the right-hand side. So exclusive breast milk, exclusive pumped breast milk, breastfeeding and pumped breast milk and formula, or exclusive formula. We then asked how much they were giving, if they were giving in a bottle, how often, and then what barriers. And the interesting part is the barriers that moms had. So we asked some of the most common that we saw: latching problems, low milk supply, poor weight gain, mothers returning to work, difficulty accessing lactation resources, lack of community and family member support, and then other. And this was what was at the 2-week well child check for every patient that came in. So asking more detailed questions. So it's the same questions at the beginning about how they were feeding, but then also about where they received prenatal care, if they received any breastfeeding education at their prenatal appointments, if they received any breastfeeding support prenatally and at the hospital, if they received any instructions on WIC enrollment prenatally and at the hospital, and also if they saw lactation while they were in the hospital and also since discharge. And then once again, the barrier questions. So then we did something called a pre-clinic, which is education to the residents before their designated day of clinic. So during that time, we talked to them about education of breastfeeding, the QI project that I'm discussing right now, and then we showed preliminary data. And this was back in August of 2020. So then those were all the interventions that we did, and this was part of the Ready, Set, Baby that we discussed earlier. So here's a timeline of what was going on during the research project. So in September of 2019, one of our Heartland nurses received her CLS certification. In October of that year, Ready, Set, Baby was given on all of the OBs after visit summaries and all staff education, and this is all at Heartland. In January of 2020, the breastfeeding documentation, the smart phrases that I discussed, those were added to all the pediatric notes. And then unfortunately, COVID hit in March and really changed how things were able to be done. In August, Heartland Armstrong moved to Knoxville, so it was a new facility. In September is when we did the pre-clinic. And then we also started at SFMC, keeping mom and babies rooming together. In October, 2 more Heartland nurses, 2 physicians, 1 APN, all became CLS certified. And then all Peoria County Family Connects RNs are also now CLS certified. In February of 2021 at SFMC is when the first latch education and support began as well. So here's some of the data that we found during this time. So for methodology, baseline data was pulled from August of 2019 through January of 2020. And our first cohort of babies that we followed were born from August 2019, and then they were followed through that first year of life. And we did ongoing monthly data collection from August 2019 to March of 2021. And this was unfortunately all a manual chart review. And so I had to go through, it was about 453 charts. And then at every single well child check, you also had to look up each of those smart phrases. So it was something that was very time consuming, unfortunately. So if something was able to be just added into the EMR in the future, that is something that would really be able to help get the data much more easily. Some Heartland newborn demographics. So our pie chart on the right shows insurance, and 87% of our patients that are seen at Heartland are on Medicaid. And as you saw earlier, that there was a big disparity in our patients that do have Medicaid. Their breastfeeding rates were much lower than commercial insurance. And then our race and ethnicity for demographics seen at Heartland Clinic, 67% of our patients are African American as well. Some newborn demographics continued for the patients that are seen at Heartland Knoxville. 79% of them delivered at St. Francis. And the zip codes that were most commonly seen at Heartland are the 61603, 61604, and 61605, which are all zip codes of Disparity. And the main location of prenatal care, 77% of our moms were seen at Heartland for their prenatal care, specifically Heartland Knoxville or Heartland Armstrong. So our 2-week survey results looked at their feeding plan prenatally, and this is what I found very interesting is 66% of our mothers were or all of the mothers that were asked, 66% of them planned on some form of breastfeeding. And unfortunately, only 63% of our moms received any type of prenatal breastfeeding education. Lactation support, something that I found very interesting as well. Only 80, or I should phrase it differently, 83% of our mothers did not see lactation after discharge. So even though, as you can see on the right, a lot of our moms had many barriers for breastfeeding, not many of them actually went and saw lactation post-discharge. So this is something that could definitely be changed in the future, is really explaining to parents and mothers the benefit of seeing lactation afterwards. Some of the barriers that we saw, the most common was a latching problem, which could definitely be helped by lactation outpatient, and also low milk supply. What was interesting about the low milk supply at that 2-week survey result is a lot of the moms thought they had low milk supply in the hospital, and that was the reason they quit breastfeeding. So really it was a lot of education where they didn't realize that it was going to take several days for their milk to come in. Some other common things that they said were that babies just like formula better, marijuana use, time constraints. The breastfeeding was just too much work. It was too much stress, and they just had difficulty keeping up with it. So here is our run chart for this time period of August of 2019 through March of 2021. So these are at the newborn visit, the babies that are doing any amount of breastfeeding. So our baseline median data is 51%. And unfortunately, you can see there really wasn't any consistent headway. It kind of just went all up and down throughout that time. It got as low as 33% and as high as 79% during this time period, but the line unfortunately never went up. And then at the 2-week breastfeeding, pretty similar results. That baseline median data is 46%. And once again, the numbers are all over the place from month to month, as low as 24% and up to 67% of our moms breastfeeding at any time at that 2-week visit. 6 months is a lot lower than any of the others. You can really see a big drop off. Unfortunately, there are several months where 0% of our moms are actually breastfeeding by 6 months. There's no median data, but you can see, unfortunately, there's no increase in that trend. It actually went down during this time. In our Healthy People 2030 breastfeeding objective, unfortunately, we were much lower at Heartland on Knoxville than what the Healthy 2030 breastfeeding objective. They want to increase the proportion of infants who are breastfed exclusively through 6 months of age. The target's 42.4%, and breastfeeding at 1 year of age to 54.1%. And our 6-month Heartland breastfeeding exclusivity is, as you can see, many months it's 0%. So it's nowhere near that 42%. Something that I found really interesting at Heartland specifically are our no-show rates. So that bottom line there that's highlighted in the pink are our no-show rates. So you can see as time goes on from that newborn visit up to the 12-month visit, by 12 months, 44% of our cohort of patients are actually no-shows and are not being seen for their well-child checks anymore. And the data for December through March of 2020 shows 35% by their 9-month appointment are no-shows. So it really shows how are we able to get patients to come to their appointment so that way we're able to actually help them with breastfeeding and continuing on with that journey and helping them with resources. Overall, this is going to be about the experience that mom specifically talked about. And if you just click each time, so these are comments, sorry, these are comments that moms discuss. So at a 2-week well child check, a mother said she had not received education about the benefits of breastfeeding and she'd like more information. Mother was French speaking and infant was being seen for their 2-week well child check at 4 weeks of age. So this was a mom that was wanting to start breastfeeding at 4 weeks of age and no one had ever discussed to her anything about breastfeeding. So that was really a missed opportunity. Another mom at the 2 weeks said she hadn't started breastfeeding yet, but she intended to. I've been using formula in public, but otherwise I'll breastfeed. So really showing that not feeling comfortable in public. I've heard stories of problems and I was too afraid to try. So really that community involvement. When asked about prenatal education, I didn't really get any. So I just Googled videos and watched YouTube videos on breastfeeding. And anyone who's breastfed before knows that that is not a great way to totally learn it all on your own and not have any support at all. Another mother was going back to work soon and was requesting information on formula, so not really knowing her rights about being able to pump at work. There were multiple comments that breastfeeding had been difficult with prior children and therefore they did not want to try again. And during times of COVID, multiple comments of moms stating that they were unable to get into the BRC or obtain a pump. So they're just kind of getting false information that the BRC was closed during that time when it was actually not. So positive things that we saw during this, because it seems like there's a lot of negative things since unfortunately there wasn't a lot of headway. But OB residents were able to discuss feeding. The Ready Set Baby became in the ABS and the flip charts in the OB rooms. Pediatric residents were able to discuss feeding barriers and really raise awareness since it's not something that's really talked a lot in our curriculum with breastfeeding. All Heartland staff reviewed the disparity data in the Ready Set Baby curriculum. 3 Heartland RNs were certified lactation specialists and are now able to provide real-time consults with breastfeeding moms. They're helping them with latch, teaching how to use pumps, obtaining pumps, educating on workplace rights for pumping at work, coordinating referrals, and discussing milk supply. Heartland OB APN is a certified lactation specialist now as well and able to provide extensive education and postpartum support for breastfeeding. And Heartland pediatricians are definitely champions for breastfeeding support. Several times as a resident, I know I would call in certain physicians that were there to come help with the latch, and they were always willing to do so, which was really appreciated. So overall, some discussion, despite anecdotal success stories and really thinking that, I know when I was on my rotation for newborns, feeling like I was definitely seeing more moms trying to breastfeed. Unfortunately, Heartland Knoxville breastfeeding rates are still very low and way below the Healthy People 2030 goals. So there needs to be a lot more work done recognizing these key driver actions and items from the Surgeon General's 2011 report to be able to help moms with breastfeeding and reaching their goals. And through this project, we learned a lot of valuable information to direct moving us forward. Something I found interesting, as stated earlier, 66% of our moms had planned on breastfeeding prenatally, but by 6 months, 0% were really breastfeeding. And even by that 2-week visit, there was a lot lower percentage than 66% of our moms that were actually breastfeeding. So they had the intention of it, but unfortunately did not actually breastfeed. We were able to train staff as certified lactation specialists, and something that came out of this too is that the residents that are willing to and wanting to are now able to take a lactation elective, which I did back in May and which was very helpful. We're seeing that families need to get off to a good start prenatally and at the hospital to have success postnatally. Also, we're working on trying to get retrievable data on the breastfeeding activity in the outpatient setting to make it easier for a longer lasting QI project. And also knowing the benefits of human milk for babies while seeing the disparity data is really a call to action for all providers, not just pediatricians, but really everyone in the community to be able to help moms and help moms reach their goal of breastfeeding. Some limitations we saw, definitely COVID changed things. There were moms wanting a lot more 24-hour discharges, and it's really hard to help first-time moms breastfeed when they're trying to get in and out of the hospital with COVID. The move from Armstrong to Knoxville and losing patients that way, and just overall lack of retrievable breastfeeding continuity data, making it really difficult to be able to see the barriers and what's going on. Some future directions, just recognizing the complexity of moving the dial on such a complex issue, continuing to partner in the community and with other medical agencies, and continuing to do more PDSA cycles, like formalizing postpartum dyad lactation support and really advocating for lactation manager to be full-time, not just nurses that are necessarily trained in lactation services, but having someone there full-time to be able to help and not being pulled in so many different directions. The retrievable data as discussed, and then also the resident breastfeeding elective that's going on right now. And during that elective, you are able to become a certified lactation specialist. You're getting hands-on training at many different locations. So you're seeing how different people do different things at OSF, Unity Point, private lactation, and also the Breastfeeding Resource Center. These are some of the references that we used during this research project. Oh, and this was my last slide for my project. This is just my family.
Oh, not just your family, Casey.
Oh, and there's another little one, I guess, that's not there right now, but a new baby who's not there too.
All right. Thank you so much.
Thank you.
We can take just a couple of minutes if anybody has questions for Dr. Zobrist. It's such valuable information and really reminds us of why we are doing this work in Peoria. I can't imagine how much time all those chart reviews took for you, Casey.
It was a lot.
And this is Shelley. She did a good job, and I think we had high hopes, but then the COVID and the move from site to site. But I think, I don't know what the group, but it just really feels like there's a lot of barriers for, because of location. And so just what you were talking about before, I feel like our moms, obviously prenatal education and getting off to good support at our hospitals, and then just bringing the support to Heartland when they're there at their other visits, and, reaching out, to me would be a dream. I mean, we have it informally, but just to be able to be where people are and really help them. So thanks.
All right. Do we have any questions? All right. Well, thank you so much, Dr. Zobrist, for sharing that information. All right. So next we have, we're going to hear from Jordan Lindsay. And I'm going to stop sharing my screen here in a minute so that we can see her better. But this is a picture of Jordan and her beautiful little Brielle. I asked Jordan to speak today because I have had the privilege of knowing her in a couple of different contexts, but was able to help her with her breastfeeding journey. And as is usually the case, Jordan taught me far more than I taught her. And we spent a lot of time just talking about her journey as a parent and her birth and breastfeeding experiences. And I asked Jordan to share this information with you because every time I had a conversation, I came away from that feeling just a little bit more enlightened about how to best help families in our community. So I asked her, and she very bravely said, yes, she would do this for us. So we're just gonna be real casual here. She's just gonna share some of her experiences. Jordan is the mother of 3 children, Isaac, Rylan, and Brielle, and she is going to talk about some of her experiences. So welcome, Jordan. Thank you so much for being willing to do this. And if you would just like to start out just by sharing your experience and telling us a little bit about yourself. Jordan, you might be on mute.
Can you hear me now?
There you go. Perfect.
Sorry. I'm Jordan. Like she said, I am a mom of 3. I had my first child when I was 17. And I will say at the time that I had Isaac, times have changed dramatically because I don't remember having any lactation help when I had him. But I knew when I had him, I wanted to breastfeed because my mom breastfed me and my sister. And then my mom would always talk to me about the benefits to myself for breastfeeding. So all the pregnancy weight that I had gained with Isaac, I lost from breastfeeding. And, you know, that normal snapback, depending on how old you are, I believe at this point. My second child, Rylan, he was born in 2019. He was also a demise. We lost him at 37 weeks. And that is where I started to open my eyes. While I was taken care of during my demise, I think that I was well taken care of for some, but I had lost my baby. So of course, everybody was very sympathetic and wanting to help. I think I did have lactation. Beth came and saw me actually. And I remember Beth making it as normal as possible. And I think with that specific experience, I appreciate that so much more now that I say it out loud, because she was probably the only person that made me feel like I didn't just lose something, because I could breastfeed with or without my child. And then in 2020, October 28th, 2020, I had Brielle, and she is now 11 months today. And my breastfeeding journey with her has been probably a roller coaster of emotions. It was like the best thing that I could do for her. It was the best thing that I wanted to do. And I was way more educated about breastfeeding by the time she came along. She was also 5 weeks early. So the benefit for breastfeeding her was way more prevalent than with Isaac and with Rylan or without Rylan. So breastfeeding her, I breastfed for 8 months. And I will truly say the data that Dr. Zobrist just spoke about, I think is very important for the simple fact of if I did not have the support that I had, I probably personally would have quit sooner, even though I went in thinking that I wanted to breastfeed for the whole first year. And I say that because it is very hard, as I'm sure some of you already know. That was probably the hardest thing I've done in my adult life, just because it's so time consuming, just because I do have my son, my oldest son is 11 now, and she is, a newborn. So I'm being split in many different ways and directions. Um, but I can tell you I stuck with it despite that because of my support. I could call Beth, I could call Unity Point Lactation team and talk to any one of them. I had family support. I had nurse support that I knew. I knew some of the nurses. So I think that relationships are very important in this field, especially when it comes to breastfeeding, just because the relationship that you have, the more that they feel comfortable and they feel that you're reliable, the more that they will come to you in those times of help. I can't tell you how many times I probably text Lisha at WIC in Peoria County about wanting to stop because it was so draining. And just having that person that I could text and say that to, and she'd be like, no, you got it. You can do it. It's okay. Just take a break. And so her telling me countless times of, you have to take time for yourself and you have to take time to give yourself what you're giving out, was so prevalent to my journey. And again, a support system is probably the best thing. And if you become a mom support system, I would cherish that, to be honest, because that relationship right there can do so much more than just a breastfeeding start, if that makes sense. Beth, is there anything else I was supposed to talk about? Did I leave something out?
Well, I am going to ask you a couple of questions here, but just thinking about what you just said, Jordan, how that relationship was probably a little bit easier for you because you well, I don't know, maybe it wasn't. Did you know Lisha before?
I did not know Lisha prior. I do have a sibling that works at Peoria County Health Department. So people know, I know of people, and people know about my sibling, but they don't know me and I don't know them personally. So that was a relationship that I had to form, but it was very opening from the time that I got in the WIC program and they said, okay, you're breastfeeding. This is who your contact. She contacted me and she had a conversation with me and she made it very clear that she was my support.
Okay, so she opened a door, and having her to text, did that make it easy for you to reach out for that support?
It did.
Because I think this is one of the things that we struggle with is how do we build those relationships? How do we get moms to trust us and reach out for our support?
So, and I think we've had a similar conversation. I think that it's very important that while moms are, in my personal opinion, should I say, while moms are in labor or before they get into the hard labor, if possible, I would think that it's important for lactation to go in there at that time. Because when I was in labor, my nurse was Brandis, and she let me know, she was actually the nurse that came to me and said, "Are you breastfeeding?" And I was like, "Yeah, I'm going to breastfeed." And she came to me with so many resources. And if you don't have nurses that are well educated and not trying to downplay that, but if you don't have a nurse that's well educated and they're not trying to help the patient, I think that's where lactation should have that chance to start that relationship, because once they move over to postpartum, you're going to see them again. And that's another step to adding to the relationship that you are supposed to be building, and so that they can see that their best interest is at heart, not only for them, but for their baby as well.
So, most people on here don't know Brandis. Brandis is one of the labor nurses at Methodist, and she is fantastic, and she is also Black. Do you feel like, just being honest, that made a difference for you, being cared for by someone who looked like you?
I can't say that it didn't play a part. I think what stood out more is that she was also a nurse that I had during my demise. So she was also a nurse that took care of me, that I saw cared for me. So I think that played more of a major part. I will say that how do I want to say this? I do think that there are a lot of people with good intentions and are uncomfortable with, I guess, can I be frank? I'm really trying to be very proper.
Yeah, no, don't be careful.
So yeah. The white nurses that I had, I don't feel that they felt comfortable coming to me and talking to me about breastfeeding because they were not lactation. Whereas Brandis was comfortable, she was educated, and it was just casual conversation. So I personally felt if I had a white nurse that was well educated in breastfeeding and I said, "Oh yeah, I'm thinking about breastfeeding," and they had a conversation with me, I would have listened to them as well.
Okay.
I think it a lot of it has to do with delivery, and when it's a casual conversation and I am noticing that you are wanting to be in my corner and saying, "Well, these are resources that if you do decide you want to breastfeed or that you're going to breastfeed, this is who you're going to talk to. And these are some of the people that might come in play. This is what we know. You know, breastfeeding is good for the baby for X, Y, and Z." And just pretty much just giving so much knowledge that you can't dispute, I would listen. And I know that I know that everybody's not like me, but I do know from dealing with other teen moms that look like me, that is a big thing to them, or just in general, really, is being heard and feeling like someone's in my corner.
Okay. I don't know if everybody heard you say, Jordan, but Brielle she was early. She was a late preterm born at 35 weeks, right? 35. And breastfeeding a baby born at 35 weeks for 8 months is absolutely amazing. Can you talk a little bit about the challenges that you had in the hospital with breastfeeding a late preterm baby, and how interventions or information that you got from the staff affected you one way or the other?
So going in, I was breastfeeding. That was not a doubt in my mind. what starts to make you feel like you can't do it is when I gave birth to my daughter and I could not physically feed her myself. So
it's 7 o'clock.
We had to figure out how to feed Brielle, essentially. So because Brielle lost more weight than she should have at the time, I was told that she would have to stay, and she could stay for a long time. That was not accurate. And so I became frustrated with myself because, one, my milk is not here yet. How am I going to feed my child? Two, a doctor has just came in here and told me my baby is going to have to stay in the hospital without me. And so now I'm panicking because I don't have milk, I can't feed my baby, and she's going to have to stay here. I will also say that when someone comes in the room and says, let's try this, and it works, you know, now you have a sense of, this is not so bad. We can do this. And then it's more like, I feel like when that happened, Beth, you would say that just a lot of ideas kept coming out. So you came in the room and you said, let's try the tube at breast, which one I had not tried yet. And it was 24 hours, I believe, before I was supposed to be discharged. And I was already discouraged. So when Beth came in and we did tube at breast and we used donor milk, I was immediately relieved until it was time to take Brielle home. And I still didn't have my milk. Like, my milk hadn't came in yet. And I was like feeling like I needed to call every place in Peoria to see who gave donor milk so that I could still do tube at breast. And I ended up actually leaving the hospital with formula, which I was also discouraged about because I felt like if I had to supplement formula already, I was going to have to supplement formula the whole time. So there were a lot of factors that scared me, but I just had to trust the process. And it goes back to, again, having a strong support system when you leave the hospital. And I know that we can't make moms come back in 2 or 3 days, but I think more moms would be more willing to come back if they have the more times they see your face, the stronger your relationship is being built with them. Every conversation, every time it's being told that, you know, if you need anything, let me know, especially if it's about breastfeeding, or I'm going to bring you this stuff to read, look over, and then I'll check back in with you so we can talk about how this made you feel about breastfeeding type of ordeal. Because if I would have left not knowing that Beth had my back in a few days and I was going to bring the baby back and we were going to look at latch and all these things, I probably would have quit way sooner still, just because of that.
We had your appointment set up before you left.
I did.
Okay. Yeah, I do think that is a key to helping parents, is knowing that they have that appointment to come back to. A lot of families tell me, like, that's what kept me going another day, is knowing that I had an appointment, you know, like 2 or 3 days, or, you know, 4 days from now. Would you agree that made a difference? Or, yeah.
Absolutely. Because, and especially for me, because Brielle was only 4 pounds and like she was right under 5 pounds. And when we left, she had lost a little weight, and she was about 4 pounds, 13 ounces or so when we left. And so going home, and then miraculously my milk coming the day that we go home was even better. So I was already at ease, but I do think that I, like, thinking back, Brielle had never had the best latch. So her, just knowing that if I had an issue here, if I remembered it or wrote it down when I went to that next meeting to get her weighed to see if she was gaining weight and do it what I was doing, what I was needing to do for her, and just knowing that somebody could tell me something, excuse me, to keep me in the right direction, that's a big help for me personally.
Okay. When did you start getting support from the health department?
I want to say as soon as I added her, I think I came home in that same week I had to add her to the WIC plan, or however that they do that. And so when I told them I was breastfeeding exclusively, then they let you know who your contact is, and then they reach out to you as well.
And she's available for you to text whenever you want?
Yes, I do believe she was available between work hours, and there would be some times where I'm sure she probably wasn't supposed to be on her work phone, but if I text her, she would text me back within the hour or early the next morning. Yeah.
Okay. Who else made up your support system?
So it was you, Beth. I reached out to Rhonda. I reached out to Ashley. Is Ashley her name?
Yeah. Mm-hmm.
Yeah. And then Lisha at WIC. Caitlin.
How about friends or family? Did you have people in your own personal circle who were supportive to you in your breastfeeding journey?
I reached out to my mom, and that was about it. My mom, but only because she understood, she was supportive. My boyfriend, Brielle's dad, he was supportive with it, even though he didn't understand it. I think that's also something that could potentially be more helpful too. That the more the dad knows, the better and more helpful he can be at home. So even little hints and tricks that were shown to us at the hospital, he came home and he was like, "Oh, they showed us how to do this. How about you change her position?" Or if I looked uncomfortable, he knew to get pillows. Just small things like that. That was helpful too. I mean, and that also makes dads apparently feel like they are doing great things.
Do you feel like the hospital staff did a good job, or I wonder how he would answer this question, of engaging him when we were working on really anything with Brielle, but particularly feeding? Honestly.
I don't know that he was engaged that much. I knew he listened a lot. I knew he watched a lot. But I don't feel personally that they engage. I mean, in general, I don't think anybody really engaged him unless we were asking him a question. I know that if we needed a pillow, Beth would say, "Hey, Dad, can you grab a pillow and put it here?" And he would put it there. And then Beth would talk to both of us about feedings. So when we came home, he would act, I mean, he was like, "She said this and she said that. You got to do it this way." So I think he definitely could have been engaged more, because it's already hard for a dad in general when moms breastfeed, because that takes away like personally, we've already had the conversation. If we have another baby, I should probably exclusively pump so that he gets a chance to bond more with the baby than he has. So I think discussing families' options with mom and dad is probably a better idea than just talking to mom about breastfeeding. So if that makes sense.
No, that's really very insightful. I'm glad that you offered that up. You know, it is certainly a reality that a lot of dads feel excluded, and they feel like the baby doesn't bond as much with them when mom is breastfeeding. So, you know, perhaps some education for them about how to bond with baby, and you know, talking about those concerns that the dad might have about breastfeeding. That's a really good idea.
Yeah, those conversations came up just because you know, you have middle of the night feedings and things like that. So while he would try to be helpful, he could not, unless it was like I was sitting up and I looked uncomfortable, or Brielle looked uncomfortable because she's this tiny baby and my boob is bigger than her face type of situation. I think that it was hard for him to bond with her. And it took, even though, you know, there's a lot of times outside of feedings, I think feedings are probably the best time to bond with the baby, because they're not crying, they're not fussy, you're not trying to calm them, but they can hear your heart because you're still close enough to your chest, and, you know, burping and all of that. I think that if he had a different experience, he probably wouldn't be so in the middle for breastfeeding. Like he understood that it was best for Brielle because she was premature, and he understands that it'll probably be best for any baby that we have, but it took away from him in general. So
Okay.
definitely give families the option to exclusively pump, or give them ideas if that's how they want to go. Because regardless, if we're going to be honest, regardless, it's going to be hard work regardless. It just is.
That was so insightful, Jordan. I have a question. You said that you were, oh, are we going to get to see her?
Yeah, she's.
You said that you were breastfed.
Yeah.
Was Brielle's dad breastfed?
I don't think so.
Okay. Oh. Hello, Brielle. Oh goodness, she's not a little tiny 4.5.
She is not. She is a good 17, 18 pounds now.
All right. Well, I have been the one asking most of the questions, and I'm going to bet that we probably have some folks on this meeting who would like to ask you some questions. So I'm gonna pause and see if there are questions from anybody else. And if there are, you can either put them in the chat or you can unmute yourself and ask. Teresa Ramos had asked, when you were talking about your experience with her and just not being able to feed her, and she had asked, was no pumping offered?
So pumping was offered. Wait, say that again.
Was no pumping offered to you? Like if she wasn't feeding well, were you offered the opportunity to pump in the hospital?
So I was offered the opportunity to pump in the hospital. Yes, I signed that little paper, but I was not getting any milk in the hospital while pumping. So that was discouraging, the first thing. But I knew I did not, we'll say what was not discussed was the option to exclusively pump and her eat out of a bottle. In my mind, breastfeeding was breastfeeding, baby to boob, and not anything else.
Okay, so that's interesting because there was a study recently that came out that said that we're not doing a great job of talking to parents about the option for pumping, and that a lot of people are just abandoning breastfeeding, not knowing that pumping is an option and that we should be doing a better job of talking to them prenatally about pumping. So you feel like you would agree with that?
Yeah, I think if someone knew the options or even what exclusively breastfeeding meant, because I can't tell you that I knew what exclusively breastfeeding meant until I truly started doing it and started communicating and talking with people. So, it's okay. Here. So I would say that that is accurate.
Okay. How did you feel about pumping as a working mom?
Like at work?
Yeah. Did you find that to be easy, or was that challenging? Did you?
I think I had my reservations, but I think enough people told me that you can pump in different rooms. They have to allow me to pump. So I think I was just more concerned about missing pumping or leaking while at work. And I think people think about the wrong things in general when it comes to that, because I mean, everybody knows what comes with pumping and breastfeeding is that your boobs get engorged and they hurt sometimes, and just having to have the being able to leave at that moment or prior to that happening and dealing with it in general, I think is the hard part. Now, as long as people are educated, I feel like they would make the right decision to continue, because they know that there's several different places that they can go to do those things. And when people don't know about their workplace, or say if I worked at McDonald's or a restaurant of any kind, where am I going to pump at? Do they have adequate places to pump? And I think that also plays a factor in it. I worked at the hospital, so of course everybody was going to say you can go to this floor, this floor, this floor, and there's a room. You know what I mean?
Right. At least there's the possibility of an environment in which to pump.
And it'd be private. You don't have to worry about. I mean, some people don't care, but I mean, there are people who do care about who sees what and how they see it, and the hospital gives you that privacy, whereas I don't know if a restaurant will give you that, but
Yeah.
they have to. So if that means you're in their office or whatever, they have to give you that because it's a law, isn't it?
It is. Yeah. Yeah. But that's one of the things. If the
People don't know.
employer has less than 50 people, then the law doesn't necessarily apply to them. And so some of those smaller restaurants, that's absolutely going to be the case. And it is difficult for people who work in restaurants to find the opportunity and a place to pump. Jordan, one of the things that you talked about that I would just like to know a little bit more, you said that you had, times where you just felt like you just couldn't do it anymore because of being tired and, just kind of taking over your life. What was it, if you had to kind of sum your thoughts up, what was it that kept you going even during those times where you just felt like you couldn't anymore?
I think it was the support of her dad, because we knew she was premature, and we wanted the fact that he wanted what was best for her, and he understood that breastfeeding for her, at least for up until a certain age, was what she really needed. I personally feel like the first 6 months for Brielle, at least, or in my opinion, a lot of premature babies, the first 6 months is probably the most important time to breastfeed, for the simple fact of this is their only nutrition. So once she started eating more solid foods, and we were getting away from milk feedings, it was more comfortable to say, you know, we don't have to do this anymore. But I think his support and him understanding how important it is to breastfeed, and the many different great things that it does for Brielle's health, was probably the thing that kept me going the most.
Right. And, you know, it's interesting that my real takeaway from what you just said, you know, as we have talked about him, is that he was a big source of support for you, but perhaps in the hospital, we don't do the best job of engaging the person who's going to be your biggest supporter. So there's a opportunity for us to, you know, have a takeaway and do a little bit better by our family's partners. So
Hey, Brandon, when we were in the hospital with Brielle, do you think that they engaged you a lot? Like feedings and anything at the hospital. Were you engaged?
Like far as being a part of it?
Yeah. Not birth, but feedings,
like
and
when she was here, yeah.
And like
I was getting a hold as far as like how to feed her, hold her, while she was getting fed and stuff like that. So, yeah, I was getting fed.
Okay, he feels differently than I do.
okay, what did he say?
He felt that he was engaged a little bit. He felt that they let him, that he was engaged enough to be a part of feeding with Brielle and things.
Okay.
But I didn't personally feel that way.
Okay. All right. Well, thank you so very much, Jordan. I appreciate. We've got so many people thanking you in the chat. Thank you for the insight. Thank you so much for sharing your story. Great information. Thank you for sharing, Jordan. Somebody telling you, a couple of people telling you that your daughter is very, very cute.
Thank you.
Somebody else saying stuff helpful. So thank you so very much for just being so vulnerable for us in this space and allowing us to learn from you.
I do have a question.
Yeah.
I mean, and I see that you guys are trying to get into the community way more. Have you guys ever thought about just, I mean, because every time that I am asked to join one of these conversations, I find out so much more about it, and it makes me not only want to be an advocate, but it also it reassures me that breastfeeding is the way to go for all babies, really. So is there any way for people like me to be more involved with the community, as you know, getting breastfeeding information out there?
Oh my glory be, you might be sorry that you just put yourself out there for that. Absolutely. We would love for you to be a part of the Central Illinois Breastfeeding Task Force. You know, I don't know if everybody noticed that Jordan was one of the names listed for our Black Breastfeeding Week event committee. And absolutely, Jordan, we would love for you to be involved with the task force. So I will chat with you about that, and thank you so much for seeing how important that is.
And I think that, as you guys know, it takes education. So if if I didn't know the people that I knew, I would not be educated the way that I am educated. I wouldn't be able to educate my family about the things that I'm educated about. So people are, I do believe there are other people out there who want the education, who want the knowledge, but don't have that resource or don't know about it. So you guys working to get it more community based is great, because I mean, I also work with teen moms. I also know a couple young parents who breastfed for the first year and they loved it too, but they still don't have that knowledge base or that resource for help.
I'm going to be picking your brain, Jordan. Thank you so much, because we are trying, you know, after kind of the excitement from the Black Breastfeeding Week event, we want to do something to capitalize on that community outreach that we did. And so I think maybe you're helping us to come up with another goal for 2022.
Yeah.
And I would love to talk to you more about that. So
Yeah.
thank you so much for unknowingly maybe volunteering for something kind of big. But, all right, so thank you again so much. I'm going to share my screen again here. Hopefully I can get this up. All right, there we go. And then we'll just wrap up here real quick. If I can. Oh, what is going on? I cannot get this to advance. All right, so what is next? So we'll have our next meeting December 14th. I already have a couple of people who have graciously agreed to present on some more community resources at our next meeting. And then we're going to have another lunch and learn in November. The tentative date of that, it's going to be a Thursday this time. We've always done Fridays before. We're going to see how a Thursday works out. So that will be another one of the noon webinars. We're going to have a really, really dynamic, very raw speaker who is also going to talk about engaging Black parents in breastfeeding. Her name is Kevin Gilmore, and she is a ball of fire. Teresa Ramos has always also heard her speak, so Teresa is probably as excited as I am about hearing her again. But look for that. I'll be sending out information about that hopefully in the next couple of weeks. So the beginning, well, maybe in the next week. So that is all I have. We do have just another couple of minutes if there's any questions. Otherwise, we will wrap up. But are there any questions? It looks like November 8th is a Monday. Is it really? What is that Thursday, Ashley? Are you looking at a?
Hey, Beth.
Yeah.
The 18th is a Thursday.
So it's probably, what is the Thursday? So 18 minus 7.
There's the 11th and the 4th.
Okay, it's probably the 11th actually that she told me she could do. I think I got the date wrong last time on that, something coming up. So probably the 11th, but I'll be sending that out to everybody here with a correct date soon. So any other questions? All right. Well, thank you so much to everybody for joining us. And there's a couple of you, Shannon, I'm going to be following up with, and Jordan, I'll definitely be following up with you. So thank you so much to everybody who provided insight on this and some feedback about doing a potential kind of drop-in, and hopefully we'll see some movement on that by our next meeting. So we'll see you in December. Thanks, everyone.